Hello, it's Dr. Scott McLean, and this is a YouTube video about the PoLo scan body. We're going to be looking at how to use the PoLo scan body to pick up an impression digitally of the multi-units for an all-in-4 bridge. It's been kind of a search for the holy grail to find a scan body that's going to pick up the all-in-4 bridge. We want to be able to pick up the multi-unit abutment especially. So the multi-unit PoLo scan body is a two-piece screw together scan body that allows you to attach it to the multi-units and then to run the arms out to the adjacent implants and then pick up the impression. The goal of this procedure is to do a number of scans to pick up the digital information to send it to the lab using this two-piece scan body. And so this is using an intraoral scanner to scan over top of this, and you can take this scan body and attach it to the implant on the multi-unit and then do the final scan. So let's meet the patient. We can see that she's had a bridge placed, so transitional bridge, and we're going to take this and start to do the pickup impressions using the PoLo scan body. So I did use the Implant Genius protocol to place these implants about 5 months ago, and the protocol went excellent, I thought, and we did get the aesthetics somewhat good, but we do have to modify it a little bit, so axial inclination is slightly off, and we'll modify this in the next phase. So we're going to scan the prosthesis that the patient's been wearing before we take it out. So we want to do a pickup of the upper arch, the lower arch, and also the bite prior to taking out this prosthesis. So as we go, we're going to go from posterior to the anterior, rocking in the anterior. So we can do a typical pickup, and I usually like to stop and let the computer render that first part before I start to do the lingual aspect, and then run around to the facial. So the goal is to get an accurate pickup of the position of this prosthesis in the intraoral cavity so that the lab can then tell exactly where the AP is, where the vertical is, where the aesthetics are, where the incisal edge of the teeth is. So a number of factors which will help to make the bridge so it's going to give great quality of life for the patient when she gets the final prosthesis. So as we scan, we want to make sure that we're scanning the whole prosthesis in its position that we've used during the processing of the bridge after we place the implants. So this was really, looked really nice, and we're able to see that the aesthetics of this were quite happy by the patient, and she was quite delighted to have teeth again after having a denture for so long. And this is something that is really so important to patients, is to leave that denture world and to get into a fixed prosthesis. Now in your scanner, the intraoral scanner, you're going to have a couple patients because they don't have places for all these data packages, and so the first scan will be done under an individual patient, and then you'll open another one to do the final scans, which we'll show you in a minute. So doing this scan, we're really picking up where the bridge is to the tissue. We can't see the tissue, of course, underneath this, so we'll have to do a tissue scan later on, but I'll show you how that all unfolds. So we can look on the screen and see that we've got a nice scan here, and we're going to proceed on to the next step, because the next step is to get a lower scan done, which will enable us to see where the bite is. So we're going to do the opposing arch. We look at this arch. It's a short arch, but it does have posterior contacts on the premolars, which I like to have if I'm doing a bridge against natural teeth. You want to have some posterior contacts so that you have support. Ideally, she'd have a partial or some implants on the lower, but that's just not going to happen right now. So we can see as we do that scan, we're doing the same scanning process that we did on the upper arch. We're treating this like it's a natural tooth scan. So we'll go behind and we'll pick up the soft tissue, and we'll pick up the teeth, and we'll get a nice beautiful scan, which will happen pretty quickly. They can usually do this under a minute now. And so my team are scanning this. They can do the first few scans and do the bite, and then I'll do the second stage, which is to do scanning of the PoLo scan bodies and also the white caps. So we'll show you that in a minute. So bite registration scan is then done, and we can pick up the impression by having the patient bite together, and then you start on one side and pick the scan up, making sure that they don't move their teeth after you do this. So you want to get in there and do the pickup of how the bite is registered, and this enables the lab to know exactly how the top relates to the bottom, and will allow them to make the new prosthesis. So this is all going to be done digitally, which is very great, because in the past we had to do analog impressions and then do stabilized bases and pick up the bite and do all kinds of different things, or just pick it up with the prosthesis that they had. So it cuts a step out, and actually the patients like it a lot better because they're not having all that impression material running down their throat. So we're going to remove the temporary bridge now, and so we'll go back in and unscrew the bridge, and our goal is then to get an impression of that bridge. So it takes only a few seconds to take this out. We like to have PVS impression material in the channels, so this comes out very quickly. And you can see as I take this off, then the patient's going to have it so that we're able to work and scan on the prosthesis by itself without having the patient there. So we call this the prosthesis scan. When we do this, we're going to start on the occlusal aspect of the teeth, because we want this to be articulated with the opposing arch, and then we'll stop. So I like to stop, let it render, and then come back and do a rocking motion as we come around, just like we would on a natural arch. And I know you've probably done lots of scans, and this makes a lot of sense to those people that have already done a lot of scanning. If you haven't, get a scanner. This is a really fabulous way for you to do your dentistry, and you need to get into it and get a scanner. So one of the scanners I like is the 3800 Dexis. I've got that scanner, and I have a Trios, and I've got 4 different scanners in my office, but some of them work better than others for different things. You can see here I'm scanning the bridge. So this is just held in my hand, and I'm rocking it back and forth and moving around and scanning the prosthesis, so that the lab will then have a digital image. They could print it if they wanted, they could do whatever, but they can see where the bridge is going to sit down on the multi-units and start to use this in their digital processing of the whole case. So we get the intaglio surface, and this enables them to know exactly how much space there is to the tissue. And you can see that this prosthesis, as I said, was fabricated by Implant Genius, and then all I did was place the implants and then pick up the cylinders in the prosthesis with bite jigs, and it was worked really well actually. So you can see here that we have nicely placed implants. This case does not have a lot of bone, and the patient is thrilled with what she has so far. So as we get this prosthetics scanned, we can then just have that in another patient file. So we're not going to relate that necessarily to the previous scan. We'll send it all to the lab, so we're sending multiple patient scans, and then they'll be able to utilize this and put it all together in their digital software. You can see at the start, like exocad, you can do this, and DTX, and so you have the scan bodies, and these scan bodies match these multi-unit PoLos. And having this design where it's an L shape, so sitting straight down on top of the implant and then going forward, enables you to have very small distances scanning the soft tissue. And that's the key to this type of technology, is not having a lot of soft tissue supporting where the multi-units are. So this scan is really showing us where the multi-units are relative to each other. And that's why they need to have not too much space between the PoLos when we're doing the scan. Now the main goal of this scan is to get a passive fitting bridge. Passive fitting bridge means that you have a very accurate impression of one multi-unit to the other 3. So the 4 being together as a unit, so we need to know that those 4 are passive fitting, so when the bridge is going to be placed, we're not going to have screw torque or breakage or problems happening because the bridge is not passive. If it's not passive, then we can't do this. So it has to be passive, and I'm going to do a verification jig and make sure that the bridge is passive on this case. So I still do that. Some people will skip that step. I would like to know before that I have a very passive bridge, especially at this point. As I get further into this, I'll probably skip that step, but right now I am not. And so what I want to do is make sure that this impression is passive. So these 4 objects, these multi-units, need to be picked up and be passive fitting, and I'll make that super clear. So when we have the first one on, then we're going to tip it so that we can put the second one on and not have a lot of soft tissue space in between those 2 objects. So the lab will be able to pick this up on their computer screen and be able to take models of the PoLo and superimpose those to get a really accurate positioning of the multi-unit abutments. This is the key to having this done. It's the same key as if you're going to do an analog impression. We usually tie these together with stabilizing wire. Well, here we're tying them together with a digital projection off of the PoLo scan body, which is a lateral projection, which allows you to have very limited space in between the 2 objects when you're scanning them. We don't want to have a lot of space where the soft tissue is the support, because this has been the problem in the past, is not having the soft tissue to cause the 2 objects to be in a different position, because the further the objects are away, this was a problem. And so that if you put on like an ELO scan body, then what happened is you're picking up soft tissue in between the ELO scan bodies, and so this caused a problem, because in the intraoral world, when you take the image, it's taking thousands of images and stitching them together. So we want to make sure that those thousands of images are stuck together in a passive fitting way. So the patient's not having any problem right now. She's enjoying the process. It's pretty easy, and we're going to place our 4th abutment PoLo scan body, and you can see that as we go on, I'm holding this again with my thumb and finger, and then I'm having the torque control, someone else is turning the torque control for me, and we can see here then that tightens it down. We'll loosen it off a little bit, but it's sometimes hard to get these on if you're just trying to take the screwdriver and do it just with a little screwdriver, because the screw's not lined up properly. So you want to hold the PoLo in position and then tighten the screw down with something else. So it's a lot easier if you have a torque control, because they're not going to swallow the torque control. That's one of the things I like to use in my all-in-4 bridges, is the TORQ control. And so we'll go through and do that. So we're going to hold the scanner horizontal to the occlusal plane, and this enables us to do these patterns of recording, so we can go through and do it one way. So we start in the posterior, come around to the lingual, to the facial, and then we go to the other side after we let it render, and we start in the posterior and move around the occlusal, then do the lingual, and then the facial. So these are the things we want to do, is to stay very posterior at the start, one direction, come back, do the other direction, and get a really nice scan. Now this is able to be seen in DTX Studio, 3Shape, and also Exicad. So you have to use one of those softwares to see these scan bodies. So you can stop the video if you want to see this, but this is some of the details from the company that makes this product. So we get a really nice scan that we start in the posterior, start to do the occlusal, then come back in, do the lingual. We're not doing a lot of layering here. We want to go one time and stop. Sometimes it's useful to use an OptiGate, as you see here, to do this scan, because it holds the tissues out of the way. Because we're really interested in picking up the position of one multi-unit to the other 3, and for each of them. So we want all those 4 multi-units to be referenced to each other based on the PoLo scan body. This is the key to this success. And here I am picking up the Ruge. You can see that this will allow us to do that orientation. So pretty cool technology. Our goal is to have a passive fitting bridge, and so I am still going to go back in and do a verification jig and make sure that this fits. So let's look at a playback of the scan itself. We can see over the occlusion, lingual, facial, one pass. Not doing a whole bunch of painting, okay? Don't keep painting to have it look perfect for your presentation. You want to just get accurate information so that the scan bodies don't have a lot of layers of scans, because you're taking thousands of images when you do this technology, and you don't want to have thousands of images all stacked upon each other because they have thickness, and so we want to make sure that we get one pass, get the information, and then get out of there. So then we go back and do the Ruge. Showed you that, and so this just helps them to orient this and to make it look good. So now we just do a final look at this, and this image is going to be referenced at the lab to the original scans. So this is how it's going to all fit together, and this is the key to having an intraoral scan technique to do multi-unit pickup. We're going to now remove the scan bodies, so we'll take the PoLo scan bodies off. So you'll hold them with two fingers because you don't want the patient to swallow these, and then we'll take this off, and you can see that we don't want this ending up in their esophagus or worse in the windpipe. So just making sure you do that. You can even put a 4x4 on their tongue just to make sure it doesn't go back that way. It was something that I sometimes do, but it gets in the way of the video, of course. Anyway, you can see here that as we take this off, then we have a scan of the healing caps coming next. And we're doing this because we want to pick up the soft tissue, because when we did the scan utilizing the PoLo scan bodies, it doesn't allow you to see the tissue. So this is going to allow you to see the tissue from a reference point between the multi-units. So the multi-units are screwed on top of the implants, and we want to pick up the tissue that's in between them. And so the soft tissue scan is going to enable you to do the proper thickness of the prosthesis, especially because this tissue has been healing since we did the first impressions. So our key is to make sure that we end up having an accurate impression at the lab, even though the patient's not there. That's the key, is to do that. And if we can do that, then we've got it made. So I'll tighten these down. Don't over tighten them or you'll have a worst day possible, because to get these off after you've over tightened them is not fun. So tighten them down to maybe about 5 to 10 Newton centimeters. Don't go up to 15. I've done that before. It's not fun. Anyway, take the scan. Have the lights off when you're doing the scan. The scanner needs the lights off. It's providing the light for the scan. If you do something different, you can have inaccuracies in your scan. So turn the overhead dental light off. You don't have to turn your room lights off, but you can just do it this way. So scan around, let it render, and then finish your scan. So I like to have, definitely where this soft tissue is underneath the prosthesis, we want to pick that up and make sure that that's captured, and go do the facial so that you have that aspect of the scan done, because it's sometimes hard to scan the facial on these because the tissue is up against the cheek, and it's a difficult area because it's movable tissue. And as you know, movable tissue in a scan is different every time you're scanning. So you try to hold the tissue taut, then do your scan, and then let go of the tissue and move on. So take these out, and they're one-time use, so you can't sterilize these. They've got to go in the garbage. So we're going to replace the prosthesis. Very easy to come back, hold it in position, put the screws back in, and then come in with a little bit of PVS. I like to use this PVS here from 3M, and so it's pink color. And so I'll fill up the channels. I'll even do this on my final restorations, just because it's easy to get it out, and then you're not destroying the prosthesis trying to get resin out. Sometimes people demand to have resin, but it's very infrequent. So this is Dr. Scott McLean inviting you to the channel, and please like it for me. It helps me. And if you can come back and visit, we'll have new videos. So it's Dr. Scott McLean. This has been the PoLo scan body video for picking up multi-units on a all-on-4 bridge.